Hi, my name is Dr. Kara Rood, and I am an obstetrician gynecologist as well as a maternal fetal medicine specialist who spends a significant amount of time on the labor floor birthing babies. So today what we're going to talk about is the JADA system. So for cases where we have abnormal postpartum bleeding or postpartum hemorrhage, this JADA system is a treatment option to help control that bleeding. So when we have an individual who is noted to have abnormal postpartum bleeding or postpartum hemorrhage, such as here, and traditional bimanual massage is not clearing and resolving the bleeding, then we can turn to a device such as the JADA device. This here is an intrauterine loop that goes inside the uterine cavity, the cervical seal that sits at the level of the external cervical os, and then here is the tubing that comes outside, and here is where we attach our vacuum source, which is our suction, as well as our syringe to inflate this cervical seal. So for an example, this here was an individual who we had chosen that the JADA is the next step for best management. We would say, hey, we're going to place a JADA to ensure everybody in the room is aware of our intentions, where they would then grab this device as well as tubing and sterile fluid to be able to place this from the hemorrhage cart. So once the device and the cervical seal, the air has been removed, we're ready to insert after we've done our manual sweep and evacuation of clots from inside the uterine cavity. To place the JADA device, it's actually very similar to some of our placements of cervical ripening balloons in a sense that I usually put 2 fingers here and then we guide the device in here, like so, into the uterine cavity. And you'll notice there's no resistance until the point where we can feel that cervical seal is kind of right at the edge of that external cervix os. And then once it's in the correct place there, then you can often see a little bit of the residual cervical seal there just through the vaginal opening. Then at this point here, we will inflate the cervical seal with 60 cc's of sterile fluid. After the initial 60 cc's are in, at this point here, we will usually take our suction and put a thumb over to make sure that it is indeed working. Attach here, where you will see almost immediate real-time feedback of the blood coming through the tube here into this suction tubing as well. And then we will place the additional 60 cc's if we feel it is indicated for that cervical seal to occupy that space. We then tape this to the side of the individual's leg and watch the blood flow come through this tubing, into our graduated canister as part of our suction device, usually often on the wall there in most of our labor and delivery room. Once we have achieved kind of seeing the blood go through there, oftentimes we will palpate here the uterus where we can appreciate an improvement in that uterine tone. While we can't always see the uterus, what I can do is show you here, depict kind of an image of what we would think the uterus would kind of feel. Once this is in and after we have source control, meaning there's not significant blood accumulating in that canister or in that tubing, the device stays in for an hour on active vacuum. Once an hour has passed and we're continually reassessing and ensure stability and no further bleeding, at that point there, we can start the observation part, where we disconnect the suction and remove that sterile fluid from our cervical seal. Always nice to know how much we put in to make sure we take out the exact amount that we put in. So something to keep in the documentation. And once all that is removed, we actually just observe, make sure that there's no further bleeding, and then this stays in for 30 minutes. After a 30-minute observation period, if there's no further bleeding, the device can then be easily removed as such and disposed of. If there is additional bleeding, which may happen in a small amount of cases, you can then re-inflate that cervical seal and reattach that suction and continue active treatment with this